Yes, hello. I'm Dr. Sun Yusuk from Pleasure Plastic Surgery. Today, I'd like to talk about a rather unique case among nose surgeries. Specifically, I want to discuss what's commonly referred to as a pointy nose. Recently, with the increased use of donated rib cartilage or autologous rib cartilage for the tip of the nose, cases of pointy noses have been rapidly increasing. So there isn't really a strict definition for what a pointy nose is. But when you look at it from the outside, if the tip of the nose looks too pointy, thin, and somewhat unnatural, we simply refer to that as a pointy nose. So if you look at the characteristics of these noses, most of them have already undergone surgery. Inside the tip of the nose, whether it's with donated rib cartilage or your own rib cartilage, a pillar is placed right here. There's actually a bone here. They insert the rib cartilage into the area where the bone is, securing it firmly, and then stack either ear cartilage or more rib cartilage on top of that to raise the tip of the nose as much as possible. That's the kind of nose shape we're talking about here. So depending on the type of tissue placed at the tip of the nose, the cartilage can sometimes show through, or the skin can become so thin that it looks awkward, almost as if it's poking out. The tip of the nose can end up looking really sharp and protruding, which makes it look unnatural and obviously surgical. Of course, there are individual differences among patients, but because the tip of the nose is fixed too rigidly, some people may feel discomfort, or when they smile or make facial expressions, the tip of the nose doesn't move at all, which can look awkward to others. These are some of the drawbacks and discomforts that can come with this kind of nose shape. In fact, there are quite a few cases where people who have had their noses raised excessively like this come to our clinic. Usually, when people try to raise the tip of the nose, the bridge of the nose also tends to be quite high. In some cases, a thick silicone implant is used, or the starting point is set too high, making the face look longer. When that happens, the mid-face can appear elongated and even make you look older. In such cases, it's necessary to naturally lower the overall raised tip of the nose. So if you don't like this hard feeling, it's common to remove the firmly fixed cartilage itself, or to remove the cartilage that has been raised too much. Alternatively, if you want to maintain a certain height and don't have much discomfort with the hardness, sometimes the column is kept, but its height is slightly reduced instead. And since the skin here has become very thin, we reinforce it with either donated dermis or autologous dermis, so that issues like the tip of the nose appearing whitish or the cartilage showing through can be improved. However, if the skin has become excessively thin, even after reinforcing it with dermis, it often takes some time to recover. In the shortest cases, it may take 1 or 2 months, but in longer cases, it can take 6 to 12 months for the skin color to return or for it to look softer. There are also two main methods when it comes to silicone. To put it simply, one method is to just remove it, and the other is to reduce its height. And when it comes to reducing the height, one way is to lower it using silicone, and another is to naturally lower it by using donated dermis. If you prefer something more natural and safer, you can opt for donated dermis. But if you still want to maintain the shape as much as possible, silicone is also a good option. Recently, there have been cases where middle-aged people come in for surgery. In those cases, since they often consider it their last surgery and prioritize safety even more, donated dermis can be a good choice. When silicone has already been inserted and you remove it to replace it with donated dermis, the pressure on the donated dermis is much less, so it tends to engraft very well. So in these cases, donated dermis can also be a good alternative. If you raise the tip of the nose this much, over time the cartilage may become visible at the tip, and because the nostrils are pulled up too much, they can end up looking like a straight line or appear too narrow, which can look a bit unnatural. These kinds of shapes can also occur together. And for the bridge of the nose, the silicone can also become visible, and there are various other drawbacks like these. So I really hope you keep these points in mind from the beginning and refrain from making the nose excessively high or upturned during your first surgery. At our clinic, we see many patients who come to us because their nasal bridge or tip is too high or has been fixed too rigidly, and they want to resolve these issues. So if you are interested in revision rhinoplasty for these kinds of concerns, please feel free to visit USV. We'll take good care of you.